Good afternoon, everyone. Good afternoon. Thank you for joining us today for this really exciting public lecture. We are really excited to see all of you here. We've got 44 people and counting still joining. So we are expecting a really robust, full room today, and we're excited to have each of you join us today. Welcome to Hamilton College. If you can see, Hamilton College and the College of Social Work here at the University of South Carolina. Our public lecture today is going to be about the global context of international social service provision from a West African perspective. And I am really excited to have a very special guest speaker join us today, Dr. Olushade Taiwo, who served as my advanced practice mentor, as well as my advanced practice supervisor during my time in Ibadan, Nigeria. So I know that many of my students are going to be joining me today, and I personally welcome each of you to the talk. And I invite everyone to connect these experiences today with both learning experiences inside the classroom, as well as professional experiences around international social service delivery. And in the United States, how we can make connections between this service delivery and the unique experiences of our immigrant and refugee communities. And so I want to take a moment before we start, because I want this to be an interactive social session. Okay, so social work is about being social, and I want this session to be interactive for us. We have many experts and learners in the room, and I'd like for everyone here to briefly put in the chat what you're most excited about learning today from this discussion. And I want you to include your status. So if you're a student or if you're a professional, and what sort of background you might have if you're a professional in the chat. And I'd like for us to use this also as a networking opportunity for us to learn about each other's interests. If Rita doesn't mind, Rita was one of the first people to share her background, and I wanted to share her thoughts. Okay, so Rita mentioned that she would like to learn more about social workers' expected duties and responsibilities to helping clients during this post-COVID-19 era. And she mentioned that although social work in Nigeria is not recognized by the federal law, this which inhibits us from functioning in various spheres. She's very interested as a student social worker in how to provide these services. And so similar to Rita, I'd like for everyone to place in the chat what you're most excited about learning today. And I will share some of those with Dr. Taiwo as she prepares for her presentation. And so as you all are entering your information in the chat and networking with one another, and I encourage you all to network with one another in the chat, I am going to introduce our esteemed speaker today, one who is very near and dear to me. She knows this already though, Dr. Taiwo. So Dr. Olushade Taiwo has a robust experience in development research, as well as policy analysis, training, and project management. In December 2018, she retired from the Nigerian Institute of Social and Economic Research after 32 years in public service. She was head of the macroeconomic group of NICER from June 2015 to 2017. Dr. Taiwo received a bachelor's degree in economics from the University of Ife, Nigeria in 1977. She earned her master's in business administration from the University of Ibadan, Nigeria, and a PhD in development policy from the University of Western Cape, Cape Town, South Africa. She also holds a postgraduate diploma in local economic and sustainable development from the Institute of Social Sciences, The Hague, Netherlands, as well as a certificate in gender policy and planning from University College in London, United Kingdom. Dr. Taiwo has undertaken consultancy services for multilateral and bilateral organizations, as well as other development agencies, including UNDP, UNICEF, EU, DFID, World Bank Institute, Overseas Development Institute, Oxfam, and Action Aid International. Her sabbatical leave in 1991 to 1992 was spent as a consultant to the Canadian International Development Research Center, West African Regional Office in Dakar, Senegal. Major policy action research and practice focus areas for Dr. Taiwo include economic development, mainly within the micro, small, and medium enterprise sector, and related issues such as development financing, financing inclusion, microfinance, and impact investment, as well as agriculture value chains and rural development, as well as community development. She also has a major focus area around social entrepreneurship, as well as civil society participation and policy processes. She has traveled widely in these areas. Dr. Taiwo was economic development practicum advisor for myself, as well as student interns from the George Warren Brown Institute of Social Work, Washington University in St. Louis, an associate lecturer of microfinance in compulsory subject and master's in project management and implementation courses within the Department of Sociology at the University of Ibadan, Nigeria. And she is the coordinator of the Center for Enterprise Development and Action Research, CEDAR, Ibadan, Nigeria. Okay, and so without further ado, I would like to formally give a very warm welcome to Dr. Taiwo as she begins. And Dr. Taiwo, as you get ready to begin, it looks like people have been really active in the chat. So I'll refer to some of those posts in my handing it off to you. So I'm not going to read everyone's, but Hope Alexander shared that she's excited to hear about economic research. Carolyn Smith mentioned that she is really excited to hear a different perspective on international work. Sav mentioned that she's a senior social work student. She's interested in learning about how COVID has affected various communities. Dr. DeHart mentioned that she is a research professor and oh, I think you got cut off, Dr. DeHart, but if you want to share your interest, feel free to in the room. Stephanie Givens mentioned that she wants to know, what does international social work look like in West Africa during COVID and how it could be different from other countries' experiences. Let's see what else we might have to share. Oh. Dr. DeHart mentioned that the tablet may be affecting responses, so no, not a problem at all. We have a retired social worker who is also a certified community health worker, now developing their own business and helping to address barriers to care. And they want to learn about COVID-19 from an international perspective as part of the talk. Chris Reed mentioned that he is the Assistant Director for the Office of International Student Services here at the University of South Carolina and very interested in the topics that will be covered. Hi, Chris. Thanks so much for being here today. All right, Dr. Taiwo, we'll turn it over to you.
Hello, Sudi. Hello, everyone. I'm so glad to be here. Sudi, you flattered me a lot. Thank you so much. It was fun having Sudi in Nigeria in 2008, I think. And since then, we've been in constant touch about issues generally. And we've been introducing each other to colleagues. So she's now my colleague. She was my intern. And it was a good experience. Also, many other interns came to Nigeria after her, and we've been contacting each other, and somehow we form a network of interns who are now professionals with me on the field. So we'll share our screen now, I hope, and we can start. It's interesting. Many people are here already, and I can see the various interests. The lady who asked about policy in Nigeria, maybe I should go up front and talk about it before I start. Indeed, there is no law about social work yet in Nigeria, but there is a broad social protection policy in Nigeria, and it had been passed. It's now an act of the parliament about 2 years ago. Incidentally, I was a member of the 6-man team that produced the social protection policy for Nigeria, and it embraces many aspects that you think is in the area of social work, because as you will hear later, social work is a very broad area, and context determine what you regard as social work or not. So the topic, of course, you know already that it's about international social services and COVID-19, which COVID-19 is a very challenging thing all over the world. I keep telling people my parents never saw this. So we are in some funny muddled waters, but I know somehow we'll get out of it if we engage in discussions like this and prepare ourselves for tomorrow that we don't know about yet. When I asked doctors about it, I saw my doctor actually in the group now, Dr. Afolabi from UCH. When I ask him sometimes about development, say, hey, madam, we don't understand it yet. So even doctors don't understand it yet. They are learning and they are giving us explanations as time goes on. So it's good to look at this issue and see how it affects life. It's an emergency. It's futuristic people, I'm sure, never knew this will come this year. So it's a major thing which we have to engage in regularly. So having said that, I will say hello from Nigeria, West Africa. By the way, this is my niece's daughter who is saying hello to everybody. I hope you like her picture. So let's go on. So I'll introduce the issue, I'll tell you about the objectives and the context. We'll do a snapshot of COVID-19 in West Africa. We'll talk briefly about what social services are, the scope of the discussion, and health services, educational services. I'm going to limit my discussion about social services to broad education, basic education and health, and then talk about those things which we take together to mean social protection, part of which goes into different fields, and the field that you are talking about in social work. It's a broad field, and it captures many things such as cash transfers, subsidies, public works, empowerment, and many things. Anyway, as time goes on, we'll get to talk more about this. And then the important thing is to see how this connects to immigrants and refugee communities, especially in the States. Next slide. Sorry. So what's the issue about? It's been particularly problematic to attain the appropriate mix of social services, especially to address the issues of vulnerability and poverty in West Africa. Health, education, and social protection indices present a dismal picture in West African societies. COVID-19, I would say, like I said, has exacerbated an already challenging situation. The pandemic, which has taken everybody the world over by utter surprise, has introduced a systemic shock that seems to be challenging all existing development models. The sub-region, that is the West Africa sub-region, is also beset now with conflict and food and nutrition crisis. Prior to the outbreak of the pandemic, I'm sure many people, when they hear about Nigeria, all they hear about is conflict, Boko Haram, and all that. So right inside this crisis, COVID came. With the global attention now on COVID, people are wondering whether pre-existing crises may even face the risk of being neglected if care is not taken. So what happens to social services programming and delivery in this difficult era? Social workers, especially those with an international focus, need to be aware of the implications for their work. So where is West Africa? Sometimes when I come here, people ask different questions. Are you from Africa? They just say, are you from Africa? When I say I'm from Nigeria, they'll say, is that different from Africa? So they never understand the location. So if you see the world map up, that's Africa, and that's West Africa inside Africa, and that's West Africa. West Africa comprises of 17 states, nation states. However, there's a regional grouping that is called ECOWAS, Economic Community of West African Regions, which is there are 15 countries in that. 2 countries actually left the Union, but we do have an ECOWAS of people and of goods and services, so there's free movement of people and goods. And sometimes we are supposed to have a common external tariff, but individual governments use their discretion sometimes to put up protection policies to defend their markets. We recently had a closure of borders, but after COVID, the borders have been relaxed a bit because it's affecting welfare generally. And also the COVID is complicating the matter. So that's West Africa for you. I hope everybody understands now. Sorry. So snapshots in West Africa, COVID was first reported precisely on the 27th of February, 2020. And by May, more than 18,000 cases and 400 deaths had been recorded. Within 1 month, COVID had spread to all 17 countries. Complete lockdowns in select locations started on 31st of March. I would say here that accuracy of data may be compromised given the low levels of testing at the beginning and non-hospitalization cases. I will tell you up front, many people in Africa didn't believe COVID existed, and even up till now, many don't, because some of the symptoms are just like malaria. And that's why recording is very difficult. Many likely COVID patients think they have malaria, and also death tolls are unreliable as they may exclude people who did not die in a hospital or who may have been mistaken to have died of COVID. Expectedly, Nigeria is where the largest number of COVID cases are. As at March 11, we had 158,646 cases. The country that is least affected is Liberia with 2,006 cases. Liberia had a war a long time ago. It had Ebola, it had all sorts of things. So thank goodness they are not really affected. And well, the region is battling the COVID seriously. The ECOWAS as a group has collaborated with the WHO and different agencies. They've set up a committee, and there are regional arrangements to address COVID, whilst each country is also trying to manage their crisis. The number of deaths in Nigeria as at 11th of March is 193. I mean, 100. Sorry, I'm not seeing well, 900 and something. I can't see. So what context are we talking about?
Can I ask a question? There was a question in the chat. Someone asked, is the mode of transmission the same as malaria? So because people were kind of confusing the two, is the mode of transmission the same as malaria?
Yes, since this is very good. Since this is an interactive session, I'm sure I'll put some people on the spot at some point because I can see some of my friends on. However, the mode of transmission is not the same. I'm not a doctor, but I know for sure that the mosquitoes cause malaria, and it's been with us for a long time. We've learned over the years, and that's why people were suggesting at a stage that chloroquine may be useful to treat COVID, because many people were taking chloroquine when they thought they had malaria. Maybe they got better, but because COVID has its own gestation and all that, they couldn't really decipher. But it's not caught the same way. COVID, as we know, can be caught when you are near someone who has it, and maybe there's some what you call maybe the person talks or coughs. That's why they ask us to cover when we're coughing, to wash our hands all the time, and use face masks, which many people don't like, but we've been forced. I mean, we've learned our lessons that we have to use them. So quickly, let me talk about the context and say that in the population of West Africa is 387. And in 1990, it was 186, and now it has doubled to 387, and about 45% of that population now live in cities. So that's a major issue about COVID, because they say self-isolate, don't move with people, and you'll hear about all that. But it's difficult because in cities, the accommodation is very crowded. People can't even afford to stay in a room on their own. 10 people may stay in a room, and you say people should isolate. Isolate where? Some people don't even have a roof over their heads. Once they finish selling their wares, they just get into a corner and get some sleep. So 30.5% of the economy is devoted to smallholder agriculture value chain, and 70 to 80% of this population, mainly women, depend on agric as their largest source of income and livelihood. 70 to 90% live on the informal sector, and they are unable to survive without some form of daily trade. So when you talk about isolation, lockdown, the whole continent went wild. Because if people don't go to town in a day, the families will suffer. It's because 70 to 90% live on the informal sector. But there's something about West Africa precisely, especially Nigeria, which I want everybody to know as a major issue of context. Entrepreneurial spirit is very high, especially among the youth, but financial resources are scarce. So they have immense capacity for innovation and social delivery, but they are incapacitated to operate because there's no way they will have the resources to do some of the things they want to do. Some of the factors I said above incapacitate the effective implementation of COVID containment because of the overcrowding. Talking about West Africa's informal sector, I'm sure some of you have seen this before, many may have not seen it before. Indeed, this is how life goes on in West Africa. The more the merrier looks like. Look at this street, how crowded. So you can imagine how distancing can happen. The context continued. West Africans also manifest some of these characteristics: culture of networks and networking. And this is through kinship ties, ethnic ties, vocational arrangements, friendly arrangements, religious organizations. But people go in groups all the time. They do things in groups, and the cooperative system is particularly strong, especially in the agric value chain. sometime in just before COVID, I went to Ghana to evaluate a project, and one of the donor-supported projects has this T-shirt which says "Cooperatives Driving Change in Northern Ghana." So kinship care for children is very, very popular. I will talk about this later when I'm talking about the immigrants. I'm here in the United States right now. Of course, because we have internet, people will think I'm speaking from Nigeria. I'm speaking from North Carolina now because I'm here to help my daughter take care of her baby. And that's how it is with many immigrants if they get a visa. So informal care arrangements for the aged and the disabled are common. And we have a culture which is good and sometimes bad. We have a culture of celebrations. We celebrate everything and anything and everything. Sudi knows that. The first weekend Sudi arrived, we went off. And I think we had one single weekend. And it was all about uniforms, about dancing, about enjoyment, music, because West Africans think when there is life, there is hope. So they say life is short. So they enjoy a lot, and the celebration economy carries the economy somehow. So traditional festivals, religious festivals, strong interest. And we also have a strong interest in arts and fashion. So there you are with Nigerian fashion. That's a friend's art. He has a gallery. Some people who are interested in arts can get in touch with Sudi. She will have his contact. People have all sorts. And fashion is a passion in West Africa. And that's why when the containment, when there were closures and things, people were really protesting. Well, they were really protesting because they couldn't but have parties. Nigeria, they call it the West African giant. You all know about Nigeria already. Very good things happen, a few bad things happen like everywhere. It has the largest economy and population in Africa, and one of every other West African is Nigerian. The sheer size is a potential consumer market for investors. About 2/3 of the population are under the age of 25. We have a youth bulge. So you can imagine what the problem will be. It's all over. The youths are everywhere, and it's causing crisis because there's no work, there are no opportunities. So the few that get their way to America come because they are looking for opportunities and alternative forms of engagement. However, many of them are professionals. Many of them like to study. I'll talk about that later. And abundant natural resources, pool of low-cost labor exists in Africa, in Nigeria. But institutional constraints and structural ones limit the capacity to be a potential production hub. Yet we are positioned to be a giant indeed that they call Nigeria in Africa. Unfortunately, we're not there yet. The jobless rate rose, you can't believe it, to 33.3%. In the 3 months through December 2020, from 27.1 in the Q2 of 2020. So because of COVID, the unemployment rate jumped up. And 40% of the total population live below the country's poverty line of 381. See how low per year. Economic inequality has reached extreme levels despite being the largest economy in Africa. So many people talk about Nigeria and say there's poverty in the midst of plenty. And finding the correct mix of policies to address this problem is a matter of concern. Like I said, daily livelihoods of rural family. I mean, people live from day to day on their income. They have to make their income every day. In the rural areas, it's also the same, but things are also even more rudimentary there. This person here is near my village. He works near my father's village. He has the cassava on his bicycle. If you know the weight of the cassava is carried, because there are no facilities. And here, there is someone you may not see tapping what we call palm wine. Palm wine is very rich wine from West Africa, very rich in yeast and all sorts of things, but we are not harnessing it well. We're not using good technology. And there he is with a rope on top of the tree. The tree is very, very high. So social services, I've talked about a bit. I don't want us to go into semantics now because there's a lot going on in the world about semantics of social welfare, social services, social protection, safety nets, and you name it. But like I said, I'll talk about the basic ones, which some of them are rights. In the according to the United Nations, some of them are, basic human rights. So the portfolio of programs I observe in the US is diverse and covers services that support the social and economic well-being of all people. Access to, like I said, access to certain social services, specifically basic education and healthcare, is considered a right enshrined in numerous declarations. As a profession, a profession of social work, the areas you deal with intersect with many other areas, international development, because many of my friends, when they even saw the title, they were asking me, Shade, what are you going to talk about? I said, you just wait and hear. It goes into community development, local development. Sometimes they talk about, different areas. So international development experts to do most of the same courses that you do. One other thing about social services in Africa is that development partners finance an average of 60% of social safety net spending. So the budget constraints in West Africa, Africa generally, fiscal space is very small. And, because of theories of growth and all that, the governments concentrate on working on things that would bring in money, but then there's suffering, so other people come and say, let's help you. So that's what we have. Social safety nets, important for improving food and nutrition security. The term social safety net actually came after, I don't know whether any of you heard about a structural adjustment program in the 70s, in the late 70s, when markets were liberalized and budgets were cut for social spending, user fees were introduced, then people were suffering. So UNICEF brought this term of adjustment with a human face, because there was suffering everywhere. So the World Bank responded and now said, well, since we started this, the Bretton Woods system started this structural thing, okay, let's recommend that countries put aside some money to take care of the poor. And they started, so the social safety nets era started, that term started during that period. But now, it's also being jumbled together with social protection, some aspects of social protection, social safety nets and all that. Many times social safety nets are like temporary measures just to get people out of it, but social protection covers more, covers universal areas of need, social needs, where some people are vulnerable and they get into the risk of getting into vulnerable situations, and they may come out of it, like in COVID situation now. Many people who are not poor before are now poor, and for that purpose, they may need to be addressed with social safety nets. Sub-Saharan African countries spend an annual average of 16 US dollars per capita on safety nets annually. You see how small, compared to Latin America, where it is 158. So in West Africa, an average of 1% of GDP goes to social safety nets. And issues that are handled under a social protection or social safety net domain are the domains where social workers work. So you can't just pass it that there's no regulation for it. It's logged in some other arrangements. And actually, there is a big social protection program, which I may just talk about later or even now, that after the social protection policy came, the security crisis in Nigeria escalated. So we couldn't pursue the protection policy as planned because most of the money that was dedicated to social protection, that was dedicated to social investment, they also call it, our vice president had an office under his supervision, which was called social investment. But when the security crisis escalated, they had to recarve out the program and call it humanitarian and empowerment or something. So it was difficult to go on with the arrangement that was on ground before, where people will be helped to get out of poverty. So most of the programs were empowerment programs, but now most of the programs under that umbrella are mainly humanitarian in nature. So there's some problem. So a global pandemic, what are the local realities? It has, of course, it has changed the way society works everywhere. Time monitoring. Many still are in denial, like I said. Social service organizations have been forced to change and adjust in new operating environment. Despite the pandemic, budgets have also been cut. You will see under health and education later that the budget has been cut. It used to be an average of 5% of the total budget before COVID, 5 years before COVID. Now that we are in COVID and we need support for the social sector, the budget has been cut to 4% of total budget, the budget for education and for, so let's go on quickly because time is not our friend. The conflict situation is exacerbating. I mean, in many states are coming due to multiple factors that we can't talk about here. Some are strain from the environment, climate change related problems, herders, I mean, pastoralists taking their cattle from one country to the other. All over West Africa, cattle is moving up and down because they're looking for water. And now, because it is a particular ethnic groups that are still pastoralists, there are ethnic clashes all over the region. So humanitarian assistance to conflict zones and refugee camps is also now being disrupted because of COVID, despite the fact that there is crisis all over. New models of blended finance is being sought quickly to avoid casualties. Containment measures. When COVID started, by the way, I forgot to say that many of my examples will come from Nigeria. However, I will be talking about West Africa generally. PTF is presidential task force was put together, a technical committee, and private sector did wonderfully well this time. They quickly, like people said, they said it's a rich man's disease because it's the rich people that travel. That's what they think. So rural areas are not affected as much as the urban areas. So the rich men, quote and unquote, the private sector got money together, cooperated with government, and they started putting together isolation centers. Look at them. Very sophisticated centers with all them facilities and all that. But some level of stigmatization was attached to it. So many people were not going to the centers. They were taking care of themselves at home, which is what was happening in many countries anyway. But because we had Ebola before, people were scared. So they didn't want people to be they didn't want to take things for granted. But thank goodness we're sorting it out. And the isolation centers, the emergency isolation centers have been dismantled. People now go, they now talk to the doctor on the phone, go to small isolation centers and all that. So we also, in West Africa, everywhere, there's a wear mask, wash hands, the 3 W's, wait at a distance. Compliance is low in low-income areas. And there's this about palliatives distribution. It was faulted due to resource gap, due to targeting problems, due to distribution challenges. Many people don't have identity. They can't identify them. They don't know. They don't have what you have here. You have social security numbers. Many people don't have. So there were limitations, and there they went. They went looting all the stores where the palliatives were kept. So you can see here, the channel's television is saying another palliative looting, another meaning there had been many before. There have been some before. So that was a problem. Constraint to effective containment of COVID. Several factors, characteristics of the sub-region prevent effective implementation of containment measures. People protect themselves. How do people protect themselves if they have limited hand washing facilities? Over 1/3 of West Africans have no water system at home. My family had to extend a pipe outside our premises to help neighbors get water so that they can wash their hands when they're passing. Lockdown and market closures, like I said, are difficult in a region where people work from day to day to earn their survival. For this reason, the government of the state where I stay said, you are on your own your action. He didn't lock down. The governor didn't lock the state down. He said he couldn't afford it, but people should own their action. So people say, oh yeah, like you say, oh yeah, in Yoruba means come on, come on, own your action. Social distancing is very complex. Fastest urban growth in the world is being experienced in this region. So social distancing is also difficult, but institutions are trying. Culture of highly populated ceremonies. Now it's prestigious to have your ceremonies in halls. Before it was open air, was in fashion. Now they're in halls, and people crumble together in air conditioner. Even now, when they wear masks, it doesn't stop it. Several family members often live under one roof, like I said. In terms of health indices, we have one of the worst in the world. 1 in 22 is the lifetime risk of a Nigerian woman dying during pregnancy. 70 per 1,000 live births by 2030 is what we have as target 3.1 of SDG to reduce the global maternal mortality rate. 2 out of 5 births are supervised by qualified medical personnel. So only 2, you can only be sure of about 2 out of 5 every birth that is supervised by qualified medical personnel. So there are problems of hygiene, there are problems of wrong, handling, and sometimes they risk the life of the mother and the baby and all that. So because people are not just cooperating, they can't afford it. So the health system had started to train what we call TBAs, traditional birth attendants, who are now trained formally to reduce the risk associated with childbirth. So in every village, you have TBAs that work with health centers and all that, and they pride in themselves. They say, we are nurses, we are doctors, because, they've taken a certificate about. So 2,300 children die every day from diseases that can be easily treated and cured. 1 in 8 children do not reach their 5th birthday. 75% of children do not receive basic vaccinations. And measures of healthcare access remain below international benchmarks, and the health outcomes are so poor. There had been a declaration of state of public health concern on maternal and child health in Nigeria by the agency in charge of primary health care in collaboration with WHO, UNICEF, all the big names in health. Emergency response was ongoing before COVID started to bring down the rate of MMR and what we call the IMR, infant mortality ratio. We have a good healthcare system in principle on paper. We have 36 states in Nigeria and the Federal Capital Territory. We have 774 local government, and in each of these areas, in each of the local government areas, there are primary healthcare centers, which are linked to secondary tier and then to tertiary. So if someone is ill, there's in the neighborhood, there's a government center where you can go and take treatment, but many people don't, and they will go to town to the tertiary one. My doctor works at University College Hospital Ibadan, and many times at the emergency, you will see someone with a wound or somebody who has a cough going to the emergency, and especially if there are accidents. You know, I told you we're a kinship system. 10 people can go with him. You say, hey, he's sick. We have to follow him and all that. So to show solidarity. So they cause a lot of problems, a lot of crowding. So effectiveness is modest. The system is good. The principle is good. And there's supposed to be free maternal and child health there, but the implementation is a problem. The system of supervision and coordination is over-centralized. There's a National Primary Healthcare Development Agency in Abuja that oversees everywhere. And it's very difficult, although they work with local governments, but the power resides at the central level. So these are things to note about that social workers can note. Community participation is improving. There's a lot now about participation, you know, in everything. For instance, in some states, the National Road Transport Workers Association cooperates with the traditional leaders so that when there's an emergency, they will call on the next available transport to take them to the referral center in town. Sorry. The grant-aided research and NGO activities are also helping rural areas to operate. Rising levels of poverty and health outcomes has worsened due to the outbreak of COVID and lockdown imposed to contain the spread. 4.4% of total budget, like I said, is allocated to health, 4% less than 2020 allocation. We're almost through. It's still a long way. Shortages of supplies. Let me just go on. What healthcare interventions are in place? There's a COVID-19 basket fund. Development partners, government, private sector, are all in it now. So the big guys, the boardroom guys are now in it. They are cooperating because they know what's happening. Everybody is affected, and like people are saying, a lot of the big rich people are dying. Stakeholders tapping into this advantage of decentralized system to introduce voluntary pro-poor interventions. UNICEF is working with partners to develop toolkits for countries to monitor and assess disruptions and impacts on containment measures and overall maternal and newborn health and well-being. Informal healthcare assistance is provided in families and neighborhoods. We have a culture of neighborhood associations, so neighborhoods also have arrangements. An impressive one is about youths who are developing very simple digital enabled platforms. It doesn't have to be sophisticated phones because they don't have, but everybody has a phone, almost everybody has. So there's these things like this have been developed to help women to have access and to reduce the cost. The situation of now on education, we have a 6334 system, 6 years in primary, 3 years in junior secondary, 3 years in senior secondary, and 4 years at the tertiary level. It's supposed to be free at the basic level and compulsory, but even then, many children don't go to school. Nigeria ranked 103 out of 118 countries in UNESCO's Education for All Development Index. 1 out of 3 children do not complete primary school. Even if they go, they don't complete it. 27.2% of the children 6 to 11 do not attend school at all. 25.8 between 12 and 17 have no access to education, and over 3/4 of the poorest women in Nigeria have never been to school, and 94% of them are illiterate. There's a school feeding program now, which is very good and have been adopted by many states, assisted by World Bank and some of the financial institutions. Conceptually, it's a form of targeted social safety net, providing both educational and health benefits, and outcomes have been very, very particularly good. I worked in a state called Osun, and it was the most impressive school feeding program. Sorry, you may not see this well, but enrollment doubled in a few years because of the school meals. And for poor families, the school meal is equivalent to about 10% of their monthly income. So families with multiple children in school can save substantially on that. So when people don't go to school, when children are sick, their parents will even go to school to collect their food. Now there's COVID, many people are not going to school. Many parents, many families are suffering because that's the main thing they depend on. The impact of education on the COVID on the education sector, 5.8% of the total budget, like I said, is allocated to education now, and less than 7% of the 5-year average of 7%. Education is already challenging. So with school closures due to COVID, access is further reduced. How many girls will return to schools? Many of them, media reports say they are getting pregnant, they are being abused. 10 million additional girls are at risk of child marriage due to COVID to ease financial burden. Over 20 million school children in West Africa are missing out of school meals, and 10 particularly in Nigeria, because it's often the only decent meal of the day for the children. So what interventions? ECOWAS, UNESCO, UNICEF, they are all intervening in this COVID era to help ensure that children don't stay out of school. Very difficult, but they are still trying. One interesting thing is that alumni associations are also, different associations, like I told you, is an associational life. Different associations are providing, support. My school donated a lot of washing points to the children, sanitizers, masks, and all that, branded. So these are some of the voluntary efforts. Other impacts of COVID: disruption in supply chains, household and businesses experience decreases in income. The inflation in Nigeria now is 17.33. It jumped from 11.4 in 2009, and it's now 17.3. So the poverty situation is getting worse. Food inflation alone was 21.79 because food prices form the bulk of the inflation basket. 2/3 approximately of Nigerian households experience food insecurity. Let me just go on quickly to the positive developments of COVID-19. You won't believe there are positive developments, of course. In June 2020, there was a 400% year-on-year growth in digital transactions during COVID because of the need to observe social distancing. IT competent youths became more engaged, more youth social enterprises emerged. My children are very busy now. They are IT people. They never answer calls. You wonder why? They say they're busy because everybody is asking everybody to develop, all sorts of IT-enabled platforms which they can engage. We also had an NSAS protest in Nigeria during COVID. People were frustrated, young people were frustrated because of many things, including police brutality. And that single event exposed latent capacities among the youth. People's eyes were opened that we really have leaders among us that we're not using. So there's need to leverage the digital adoption trend to solve some of the most pressing needs of low-income households and individuals, particularly women and children and MSCs. Digitization of social services provides a basis to achieve scale and efficient implementation of cash transfer programs that require physical verification of payments, so people won't need to go on queues. To get ID cards, they have to queue everything. Now, what's the connection of all this to migrations? I know that's what will interest your school. Migration remains essential because West Africans in the diaspora have strong sentimental and material link with their countries of origin and support families through remittances. This remains the main support source for home countries. Many West African governments remain dependent on external aid to finance priorities. However, despite IMF and finance clubs giving us concession on our loans, it's still difficult for government to meet its obligations. ODA is classified to social development, multi-sector, and humanitarian assistance. But the humanitarian assistance is taking all the bulk of money now because there's crisis everywhere. So Northeast humanitarian work is gulping a lot of the money. ODA, accessing ODA, overseas development assistance, is problematic now because donors are also withdrawing due to the pandemic. Remittances are there for the life wire to sustain social activity, social welfare at home. 70% of remittances into Nigeria from the diaspora goes into social services through family support, 30% to investment. Diaspora remittance has continued to surpass oil revenue in Nigeria, translating to as high as 6% of GDP. In 2019, Nigerian remittances was 25 billion, the 7th largest remittance in 2019. A drop of 8.8 in 2020 was envisaged by the World Bank and predicts that it will be 14% drop in 2021. Despite the impact of the pandemic, the remittances still keep coming. So many people are in the diaspora here, many Nigerians, they are gifted people, but we have doctors, we have lawyers, all sorts. The details, I won't go into the details now, the percentage, because I've run out of time. I can see. Sudi, can you check me? Because you spent...
We've had a very active chat going on, so I'm sure the questions and dialogue will be good, and you can pick up on other talking points. Can you just share remittance to everyone just so that they understand what that term means? Oh, I think Dr. Taiwo froze. Oh, you're muted.
Oh, okay. Can I still talk about the remittances? Yes. Oh,
absolutely.
Not going back. Oh, okay. Yeah, what I'm trying to say is that remittances constitute the major component of money that is spent on social services in Nigeria now. And because many Nigerians many West Africans are outside their countries because the countries are not, comfortable for them. In 2017, 40% of Sub-Saharan Africans held a bachelor's degree or higher, compared to 31% of total foreign-born population and 32% of the US-born population. So Sub-Saharan Africans were more likely to be employed in management, business, occupations, and all that. How do Nigerians fare? 21% of immigrants living in the USA are from Nigeria, driven to pursue careers that utilize their skills and provide a sustainable financial future for their families. Nigerians and South Africans were the most highly educated immigrants, 61 and 58 respectively, followed by Ghana and Liberia, which are also in West Africa. Nigerian immigrants were the most likely to hold management positions. Nigerian communities abroad are among the best educated, specializing in fields of human endeavor. Although there's also poverty among the immigrants, 19% of sub-Saharan immigrants lived in poverty in 2017, compared to 15% of all immigrants and 13% of the US born. Nigerians and Liberians had the highest rates of those unlikely to also be covered by private health insurance. So these are issues that social workers need to know about, when you are doing your projects. So why is cultural competence important in social service provision? You know more about that than me. But you need to know people before you know how to intervene in their issues. It is of most important that organizations are sensitive to the particular needs of culturally and linguistically diverse populations they serve through programmatic services. Relevant lessons learned. Migrants and refugees come to the US for better opportunities. They have a networking culture, ethnic and cultural affiliation, religious affiliation, kinship care system, high regard for educational attainment. Everybody wants their children to go to university. Youth entrepreneurial potential and creativity, strong ties with home countries, which can be tapped. It's a win-win situation. Refugees and migrants share many of the same challenges, but they lack effective access to finance, employment opportunities, and uncertain futures. Refugees and migrants may become diaspora investors or returnees in future. So whilst they are here, tap them properly. So possible areas of work. With immigrants, targeted vocational services for obtaining higher degrees, well-focused targeted women's career development to support refugee parents and children, direct employment assistance, writing resumes, interview preparation, job search, job applications, other supports, credential evaluation, mentorship services when appropriate to provide guidance in the fields of choice, skill building, boot camps, youth ideation platform. Youths are in phenomenal from West Africa. So they can partner with youths here and bring up ideas that can benefit the whole world. So grants and concessional entrepreneurship loans would be very, very useful. Initiative to improve financial inclusion of migrant families, remittance-linked financial assistance. Then United States immigration system may be found to be complicated by many, but when immigrants depend on informal assistance, they may sometimes be exposed to illegal arrangements, so they need support from social workers. Hence, need for provision of low-cost, high-quality legal services for immigrants. Capacity building to make informed and legally compliant choices in the American system is very important. Community organizing and advocacy, promotion of linkage with diaspora offices in home country, counseling through volunteers who have cultural competence, protection against employer exploitation, domestic violence, and child abuse, virtual advisory sessions and hotlines to comply with social distancing. You don't have to go to them. You can give them advice on phone. Now I want to do a project showcase. Sudi is one of the project showcases. She was one of my past interns, like we said, and this lecture is an outcome of our most impactful, I will say, and continuous interaction with me and my network of professionals in West Africa. We've been together everywhere. I've been to Sierra Leone with Sudi, right? One other intern who remains anonymous was to learn if community service was done in Nigeria, how volunteerism worked with children, youth, and young adults. After putting together the information from field research, she identified a twofold problem. They need to both develop more formalized volunteer programs for youth and increase access to higher academic achievements of Nigerian youth. So she birthed Team Reading Outreach and Mentoring Program, Trump I. It's reported in one newsletter, that's why I could quote them. The key lessons from her project: importance of full engagement within the program environment, importance of being aware of your audience, importance of creating quality data collection instruments, what it means to be an outsider, regardless of her being black, she was still feeling like an outsider at some point until she understood the environment. The intern states, having my first international experience in Nigeria was nothing short of amazing. Although there were moments of frustration, of course, everybody in a new place will be frustrated because of cultural differences. It was a great learning experience on both professional and personal levels. Conclusion: culturally sensitive interventions based on the described context could support mutually beneficial outcomes. We are therefore open to discussions on win-win models. What benefits America? What benefits the diaspora? The home country, West Africa, of possible engagements and collaborations with a consortium of reliable, I mark that, effective development organizations in the West African sub-region. Thank you for allowing me to bore you greetings from West Africa in different languages. Pidgin say, you know, do well, oh. I'm sure Sudi likes that. So for questions, yeah, and I know why. So for questions or potential collaborations, these are the email addresses. And many of my colleagues are even here in the meeting. In case you want to get in touch with us later, you can contact us. Thank you.
So that was a lot of detailed and very heavy information, Dr. Taiwo, and we really appreciate it. So the floor is open for questions, and I'd like to move back in the presentation to talk about some of the COVID-19 immigration experiences that Dr. Taiwo highlighted. So please put your question in the chat and prepare to unmute yourself to ask Dr. Taiwo a question. I think the thing that most interests me that we need to be made aware of is that immigrants and refugees will still feel a sense of, even during a pandemic, a sense of responsibility to connect with ties back home and to provide supports. And so, what are the things that social workers need to keep in mind, knowing that these are the responsibilities that they have? And others can put their questions in the chat as well. So, my question to you, Dr. Tawil, is what are some of the things that social workers should be thinking about, knowing that immigrants and refugees in the US will still be maintaining these strong ties and feel a sense of responsibility for continuing to support relatives and families in their home countries?
Yeah. What will be important to social workers?
Yes.
To know that, yeah, since they need to know that there are opportunities that can be tapped here, and they have to work with them to ensure that they are also able to contribute to, I don't know what you mean. Let me see again. Yeah, they will send money home, of course. They spend money here, they pay taxes here, but they need to be helped to ensure that they are not distracted by, they have to send money home. I don't know. I'm not really, I've not thought about it. I've not thought about that.
Yeah.
Maybe somebody
And
can help
so,
me.
right. No, I think what you're saying is a great start. That I don't think that we need to make some really strong connections between the supports that are available in the U.S.
But it keeps them stable if they're not getting in touch with home. They're not. I mean, people keep worrying them from home all the time. There's nothing they can do. And if home is settled, then there are opportunities that can also be. So some of the things social workers need to know, need to direct them to legal processes. Now there's a lot about remittance ways of sending remittances. There are illegal ways and all that. So maybe some of the things social workers might need to do is to also equip themselves with knowing about legal ways of remitting money to their home countries. The Central Bank of Nigeria has now tried to establish that people should use the official means of sending money. Before, people were using all sorts of funny means to send money home. Well, I'll think as time goes on, I think it will come. I think I was overwhelmed trying to beat time, so I can't get my head together now.
Right, so much, but thank you so much for that. And what are other questions or comments? People can unmute and ask a question, or you can put a question in the chat. One person is asking if they may have access to some of the information that you shared in the PowerPoint. So if you want to edit anything or formalize it and send it, I'd be happy to send it to the attendees from today, if you're okay with that.
That's right. That's correct. Sure.
Great. What are other questions or comments? So one person asked, this is a question regarding a misconception mentioned earlier about the idea that COVID-19 is not real. Do people typically think COVID-19 only affects the rich, as in only they get sick with it, or is it that, or that is there to benefit from it if you're rich? And Sab, maybe you can unmute and ask the question. I'm curious as to how it compares to some misconceptions in the US. Sab, you can unmute and ask.
Yeah, I think during the PowerPoint, somebody had put in the chat that there was a misconception in West Africa that COVID-19 was not real. And I think they attributed it to commoners, was the term used, not getting it as much as people like politicians and stuff. And I was wondering why that was. Like, did they think that it only affected those people and they were the ones that got sick, or that COVID was like created to benefit the rich or is there to benefit the rich? I was just curious about that comment.
Yeah, there's always suspicion about government, announcing things, especially when it has a budget item attached to it, when it's a global issue and all that. And as I said before, malaria is very common and could make you very sick. Malaria sometimes leads to mortality. So people didn't believe it. They thought there was a trick somewhere. There's also all these conspiracy theories. Maybe the Western countries will have something to gain from it or all that, and it's all over the world anyway. It's not in Nigeria. But the African one is peculiar because of the malaria that we've been having, and because the rate at which it was spreading is not as much as in many other countries. And then recently we are now getting to know that there are many strains. So the strains that came before were not very deadly, something like that. At some point, it keeps changing though. But of course, Nigerians are travelers. Many West Africans, they travel a lot. So as they are going and coming in, the strains are mixing. So people are really confused because everybody gets sick around the time that it started. So it's one, because of malaria, two, because of conspiracy theories.
Thanks, Sav. Great question. Adefemi, did you want to ask your question?
That's my doctor.
Just to contribute, thank you very much, Dr. Taiwo. I want to contribute to that question about misconception. It's about perception of the people and how much education the government was able to, about the disease, the government was able to make available to the local people. The people, just before COVID-19 came to Nigeria, there were a group of Nigerians who went to UK to hold an 88th birthday party for the ambassador of Nigeria in the UK. And most of them came back probably with COVID-19. So that gave the conception that it's a disease of the rich people who have traveled and brought it back to Nigeria. And some of them, like Dr. Taiwo said, were treating themselves in their homes. They didn't want to come out because it was like a stigma as at that time, until the government waded in and started visiting them in their homes to go to the isolation centers. So to the average Nigerian, they didn't travel to UK. They have been in their villages, in their towns. So why should they have COVID-19? So the non-pharmaceutical interventions like wearing your mask, social distancing, hand washing, and sanitizing was not something they took actually as a serious affair, because they think it's a disease for those people who are actually educated or who are rich. But eventually everybody got to know that COVID-19 is something serious. When the governor of the state got infected, of our state got infected, the director of my hospital and the chairman of our hospital also had infection during a board meeting. So all that spread the news. At the time, the people in Oyo State thought that UCH is the center of COVID-19, just because patients come to UCH. But then education was lacking in the public. And this is an area that the social work can intervene, make governments to educate the public on diseases like this. That is what I think brought that misconception. But now people know that COVID-19 is for real. Yeah, there were school closures for children during the lockdown, but gradually the schools have been opened with maintenance of physical distancing. Some public schools now run 2 shifts of school, 2 shifts, morning and the afternoon shifts, just to reduce the population of students in class. So there were school closures, but then these have been relaxed because you cannot afford to let that affect the education of the students for so long. So the school are no longer closed. Universities also are coming back. My university, the medical school in Ibadan, our students are coming back physically on ground. The final year students are back. Not only because of COVID-19, there was an industrial action, but they are back now. But because of the COVID-19, we are still finding a way of getting the lower classes to come back physically on ground. But they are getting their lectures online by Zoom, by some other methods of being lectured. For those who are at home, but the final year students who will graduate this year are physically on ground with us. Thank you.
Thank you, Doctor.
We probably have time for one or two more questions. So did anyone else have a question or a comment, or did they want to elaborate on anything that Dr. Taiwo mentioned earlier? Okay. And while others are thinking, I do think that this brings up another question for me, which is, what are some of the common perceptions around like accessing health care services for individuals from a West African perspective that might influence how they perceive accessing healthcare services when they go abroad?
For the professionals or for people at home?
For people at home.
Access. We don't have the kind of insurance system you have here is a recent development. They're introducing community health insurance now. So access is mainly out of pocket. So if you don't have money, you don't access. That's why people resort to alternative remedies. Even during this COVID, many people are using all sorts of concoctions, and they believe, in fact, many people believe it's because they are taking concoctions that they're not sick. Everybody has almost at the back of their house, bitter leaf, mint leaf, all sorts of things. And there are people who buy over-the-counter medication and pack them, in small packs and hawk them around. So, because to get to hospital is difficult, the primary healthcare centers are trying their best, but many times they don't have staff. Many times the siting of the centers are politically motivated, so people can't access those places. I've done research in a health center before where we didn't receive any patients for almost a week because it was far from where the people needed it. But in recent times, there had been changes. Access is a problem if you don't have money. There's supposed to be on paper free maternal and child care at the primary level. I told you there are 3 levels. At the primary level, you can walk in and just take medication free. But many times the medication may not be available. So NGOs, international partners are all trying to help to give supplies. And then many projects come that are ad hoc and specific. So sometimes, and they give preference to poor people, especially in the rural areas. So in such situations, people have access. But when you have diseases that you need curative, not preventive. Most health centers deal with preventive illnesses or things that you can get over-the-counter drugs for. But getting to the tertiary level is particularly difficult, although there it's also subsidized to a large extent. I would say it's actually cheaper in West Africa, to treat an illness, but the problem is having access to the resources to be able to treat yourself, because the insurance system is not very, very sophisticated, although it's being introduced gradually. I hope that answers it.
Absolutely. So it will be something for us to keep in mind in the US,
Yeah.
Individuals' orientation
Yeah.
to healthcare systems and insurance provisions may not be familiar because of the systems that they may be coming from, depending on either how robust or how educated they are about those. And I'm glad to hear that they're developing some community insurance partnerships to try and support accessibility and make it more affordable. But immigrants and refugees in the US may not know about these provisions or understand the rights that they have to access to medicine or the access to services. So this is certainly something to keep in mind. Yeah. Thank you so much. So we've got about 5 more minutes. Is there a last question? Any last question or comment? Any final words, Dr. Taiwo, that you would like to share with us? In sharing final words, I just want to acknowledge the students that are here today. I want to acknowledge the administrative professionals that are here today. We have researchers, interim deans of curriculum that are here. We have study abroad partners. And I most importantly want to recognize our international affiliates who joined all the way from West Africa today. So it's what, 5 or 6 hours ahead for you all. So it's evening time. And they logged in to be a part of this session today. And I just really want to thank them for taking time out of their very busy schedules to be here today and join in this conversation, for lending so much knowledge and experience to the chat. So I just really want to thank you all so much. And Dr. Taiwo, do you want to leave us with any final words?
Yeah, just to say thank you very much for having me. And I hope to come again, hopefully, and to hear from some of you. I've shared my email address. And if you need any information, you need any help relating with anybody in West Africa, you can get in touch with Sudi, and she'll get in touch with us. If you need to have access to resources, addresses of resources that you may need, galleries you want to watch online, things you want to know about, more about the practices, social practices, and models of social. If you see the background, you will see there are many youth entrepreneurs that are doing many projects that actually supply social, that make provision for social services. Some of them might be useful for some of you future to get ideas of social services projects. And I will say thank you once again, and have a nice day. Thank you. Enjoy the rest of your day.
Yes, we'll stay on for a few more minutes just so there can be some further networking for those people that do want to stay on and get direct contact information for anybody that was on the call today. You heard that there are doctors and other professionals that are here. So I would love for people to exchange contacts for those people that are interested in any opportunities, whether or not those are learning opportunities or research opportunities or service opportunities or the like. So feel free to stay on for a few more minutes for some networking. I'm sure Dr. Taiwo will want to chat with some of her colleagues who were able to be here today. And so thank you to others who attended. Have a great rest of your day. And we'll hang out for a few more minutes and exchange some contact information for those who want to stay on. Have a good day, everyone. All right. And Rita, thanks so much. I will put my contact information in the chat. I'm going to put it in the chat for everyone so that if anybody wants to get in contact with me, you can feel free to do so.
Okay. Yeah, I can see Rita, who is one of your students. She comes from my area.
Okay.
I think she's one of your students.
Yes, and I think there may be something else in the chat. Let me just double check.
Thank you. My friends are also here. Thank you, everybody.
Can I maybe get some info?
Yeah, I've
Maybe
seen Rita.
Okay, yes.
Ola Busola. Thank you. Willie, thank you.
Yeah, Willie is actually interested in possibly traveling abroad. Willie Cook, he's one of my students.
Well, after COVID.
I have a passport.
He does have a passport?
I do. I actually have 2 passports.
Oh,
wow. Yeah. Good. Once COVID is over, give me a call.
Yes.
Thank you. I had that. Thank you.
Rita, I sent you my contact information. Thank you so much for being here.
My siblings, thank you. I can see them. Tolu, thank you. Damola Layade, thank you. Everybody, thank you and goodbye.
Wonderful. So of course there has to be a part 3 now, Dr. Tyrell. We have to figure that out. Part 3, what the part 3 needs to be. So if I were to ask you offline, just because we still have time, you know me, I don't believe in wasting time in these last 2 minutes. What needs to happen next? What needs to happen next? Where do we go from here? And that could be from anything that you've shared today. Where do we need to go?
I think we can have virtual discussions. We can have group. The kind of thing we planned with was, is this St. Augustine's or St. Andrews, or what do you call it?
St. Augustine College. Yep.
Augustine. We can have joint fora, you know, where Africans will be online and you will be sharing the same resources, and then we can develop projects together, share models and things like that. So that would be the first thing. Let's even just get a database of associates who want to continue dialoguing. That'd be a good one. Then we can later on try and think about interdisciplinary research ideas and other things. Yeah, then we can find a way of working with diaspora here, with diaspora groups, professional groups, yeah. But let's first of all get interested people that want to like network. Absolutely. And then have virtual opportunities to work together.
Good.
For a start, yeah.
Thank you for that. Last word, does anybody here want to say anything or share anything before we go?
Thank you.
All right, hearing none, thank you all for your time.
Bye, everybody.
Today. Have a good day. Bye.